Hello everyone. Today I'm going to talk about the healthcare in the United States and the policy that I will implement in order to fix some problems of the current system. During these presentations, we are going to go through the current type of health system, some statistics about insurance, ways to get insurance, the healthcare reform, the policy and its advantage, disadvantage of the policy, and a little conclusion. Let's talk about the current type of health system. United States is one of the richest developed countries in the world. However, it is one of the few developed countries without universal health coverage. Its health model is free market and its mixed system. It has a complex public-private payment structure where the private sector dominates all public reimbursement mechanisms. There are a few ways to get insurance. You can get insurance from programs financed by public money. You can get insurance through your employer, or you can buy the insurance individually. The medical insurance offered are Medicare, Medicaid, insurance through companies, military, health, TRICARE, and state health insurance program for children. A survey conducted a few years ago reveals that 48% of Americans obtain health insurance through their employer. The 5% of Americans buy their own insurance. 13% of them get it through Medicare, 18% through Medicaid, and the 16% of the whole population have no insurance at all. Moving forward and talking about a possibly health reform, we can set two main problems in the healthcare right now. One of them is the high prices. The United States has a privatized healthcare where no one knows what anything costs. And the other problem is the exorbitant profit of health entities in the United States. Doctors and hospitals know that insurers follow everything, so if a treatment is marginally more effective but much more lucrative, they don't hesitate to recommend it. There are other countries in the world with healthcare managed by private insurers that do not have these problems, as is the case of Germany. The mechanism they employ is very ingenious. They simply establish price controls, and then insurers and the government literally say what things cost, and it is done. A similar system is my idea of policy for the United States. The policy is an all-payer system. It is based on a price control system. With this system, a state commission decreases yearly the cost of each of the hospital services in the state, and everyone pays exactly the same. It has the possible to implement at the state level. It's a really effective system controlling prices, and this type of system don't eliminate the private insurance industry. So that scheme will accommodate libertarians, for example, who do not wish to be told by the government what to do about their health insurance. Some of the advantages of this system are that all payer rate setting systems are not a new innovation. It is a system that has been already carried out and is known that it is really effective. The states implement these measures to address rising healthcare costs and improve price competition among hospitals. A good thing of this system is that limits what hospital can generate in annual income, so it will help regulate the exorbitant profit of health entities in the United States. And for example, Maryland remains the only state that regulates healthcare prices through this kind of systems, and thanks to it, they have saved a lot of money. Some of the disadvantages of these systems are that the system requires the participation of the federal government by Medicare, which may require an additional cost of entry. Although an additional input cost is required in the long run, this system saves a lot of money, as I said. A 2017 study found that the program created net savings in the amount of around 300 million for Medicare in its first 3 years. And the other disadvantage is that the opposition from health entities saying they will lose a lot of money. There have already been attempts to implement this policy in different states, but the Association of Doctors and Hospitals usually manage to stop it. They're really busy. As a conclusion, we can say that implementing this policy statewide in the United States, if implemented, will help to correct two of the biggest healthcare problems in the United States: the high prices and the profit system that hospitals, pharmaceutical companies, medical groups, and others carry out. Thanks for watching, and see you in class.